So if your patient come to the clinic complaining of like cough, how do you know like if it's acute bronchitis or chronic bronchitis or even like a pneumonia? Okay, let's talk about it. So let's differentiate between acute and chronic bronchitis. So acute bronchitis lasts less than 3 weeks and it's almost always viral, even if the sputum is green. Green sputum doesn't mean like, oh, it's bacterial infection. And the symptoms are like cough, wheezing, chest discomfort, mild fever, not high, mild fever, some productive sputum, okay, and the treatment is like supportive. We're not going to use any antibiotics or anything like that. So fluids, rest, antipyretic for fever, cold mist humidifier or hot steamy shower. If they are wheezing, then we can use like short-acting bronchodilator like albuterol. And for cough, we can give them dextromethorphan, tessalon pearl, or guaifenesin. So do not just like jump straight to the antibiotic. Always consider bacterial if the cause, if like only if the patient is not improving. Like it's been more than 3 weeks, they're not improving, then that's gonna be bacterial bronchitis. But yeah, acute bronchitis is almost always like viral, so we don't need any antibiotics or anything like that. And the red flags for pneumonia are like if they are getting like high fever, if tachypnea, if hypoxia or focal crackles, or like if we do chest x-ray, then the abnormal chest x-ray will kind of like help us rule out pneumonia versus the bronchitis. So now let's talk about chronic bronchitis. So what really is chronic bronchitis? If the cough is more than like 3 months each year for at least 2 years, all other causes are like excluded. So this is kind of like considered a form of like COPD, and it's commonly linked with smoking. And the symptoms are chronic productive cough, of course, fever, dyspnea, wheezing, recurrent respiratory infections. And how do we manage it? So we treat chronic bronchitis like a COPD exacerbation if symptom worsens. So we can use like bronchodilators, steroids, smoking cessation, not to forget that, and oxygen if needed, antibiotic if appropriate, like augmentin, cephalosporin, macrolides. And the biggest takeaway is always ask your patient, like how long the cough has been going on. This question kind of like changed everything. So acute bronchitis is usually viral and temporary. Chronic bronchitis is long-term, your disease. So yeah, thank you. Bye-bye.